To improve the management of SBS, the AGA Institute and ACHL have developed a professional hub. So whether you're an expert looking to train as an educator, a clinician looking to stay on top of the latest advances in SBS through personalized CME, or a hospital or clinic looking to support educational programming for your team, take a quick look on how the AGA Hub can help you achieve your goals. Interested in becoming an AGA-recognized SBS educator? Through our first pathway, you can complete our training to become an AGA-recognized SBS educator using the CDC Training of Trainers framework. Your training begins with an assessment across 5 SBS content domains to measure your knowledge of this content, as well as your skills and interests. Upon answering each question, you can review clinical pearls and see how you're performing relative to your peers. After completing each domain, you'll receive a report card directing you to training materials and a personalized mix of resources. Upon completion of all domains, you'll receive a final summary of your results. Following completion of the assessment, you'll then proceed into the training portal, where you'll review expert-developed SBS content highlights and training materials on program facilitation strategies and adult learning principles, and learn how to build customized presentations using the ACHL Custom Ed platform. Once training is completed, download your AGA-recognized educator and SBS certificate and decide if you want to opt in to the AGA SBS Educator Directory, through which trained individuals can be selected by groups interested in receiving a presentation on SBS. Or you can opt out of the directory opportunity and instead access materials for yourself and/or to present to your team. As a trained educator, you can access ACHL Custom Ed to support dynamic, personalized educational experiences as you develop a customized slide deck to present to your team or to other sites across multidisciplinary and multi-specialty teams. You can continually tailor your presentations to best meet the goals and needs of your audiences. Not interested in the training or becoming an AGA-recognized educator, but looking for CME on SBS? Interested learners can directly access Custom Ed to receive CME credit without completing the training. Our second pathway is for those who want to design personalized education from a library of over 250 slides developed by expert faculty in pediatric and adult gastroenterology and earn CME. Answer a few brief questions to assess your interests related to epidemiology, pathophysiology, and etiology of SBS, clinical manifestations and prognosis, treatment strategies and goals, treatment advances, and achievement and maintenance of enteral autonomy. Next, select slides from 6 overarching topics and their subtopics to create your personalized education. Our third pathway is intended for hospitals, clinics, and other organizations looking to schedule a live virtual presentation with an AGA-recognized SBS educator. Does your team treat pediatric or adult patients with SBS and have an interest in learning about some of the varied aspects of this complex topic? Would your team benefit from a program focusing on nutritional support for these patients? Educators are trained to deliver targeted education considerate of diverse skills and practice settings while applying adult learning principles to foster engagement, promote critical thinking, and acquire enhanced clinical competency. Access our directory to share your contact details, date and time preferences, topics and program length, and number of attendees. You'll select up to 3 preferred educators, each of whom is prepared to develop an educational program customized to meet the needs of your team and the diverse patients you treat. Automated emails are sent to both the educator and the requester, while details are communicated to each party. Once an educator accepts the invitation, the requester receives their email and can begin communicating logistics and details directly with them. Get ready for your presentation. Ensuring that all clinicians have the knowledge needed to assist patients in progressing toward enteral autonomy and improved quality of life is a critical component of education about SBS. Regardless of the pathway you choose, we hope you will join us in improving outcomes for patients with SBS in both the pediatric and adult care settings. Begin your personalized journey with the AGA Hub today.